One of the most effective pieces of NMN and NR marketing is the promise of no flush. The niacin flush, that wave of skin redness, warmth, and tingling that hits 15 to 30 minutes after a dose, has been positioned as an unpleasant inconvenience that modern NAD+ supplements have helpfully eliminated. What this framing conveniently omits is the growing body of evidence suggesting that the flush isn't a bug in niacin's code. It may be a feature. The flush occurs because niacin binds to the GPR109A receptor on immune cells in the skin, triggering the release of prostaglandins. These compounds cause the blood vessels near the skin surface to dilate rapidly, producing the characteristic redness and warmth. This is vasodilation, an increase in blood flow driven by a genuine pharmacological response. And here's what NMN advocates rarely mention: vasodilation has real therapeutic value. Improved blood flow means better oxygen and nutrient delivery to tissues, including the brain. The same mechanism that creates the temporary skin reaction may be simultaneously improving cerebrovascular circulation. NR and NMN avoid the flush entirely because they don't engage the GPR109A receptor. In marketing terms, this makes them more comfortable. In physiological terms, it means they bypass a mechanism that niacin uniquely activates, one that produces effects independent of NAD+ elevation altogether. You're not just avoiding a side effect when you choose NMN over niacin. You're foregoing a vascular pathway that niacin has essentially to itself among NAD+ precursors. The discomfort of the flush is also dose-dependent and significantly reducible with proper titration. Starting at 50 mg of niacin with a meal and increasing by 50 mg per week allows the body to develop tolerance gradually. Most people who follow this protocol report that the flush diminishes substantially within a few weeks of consistent use, often becoming barely noticeable. Taking aspirin 30 minutes before a niacin dose blunts prostaglandin release and reduces flush intensity. Eating an apple or applesauce shortly before the dose has a similar mild effect. Extended-release niacin formulations spread the dose over several hours, softening the flush curve. There's even a case for timing the flush strategically. An evening dose produces the flush while the person is winding down, which many users report actually aids relaxation and sleep onset, likely due to the peripheral vasodilation reducing core body temperature, a known sleep-promoting mechanism. Others use a morning niacin dose before exercise, using the circulation boost as a pre-workout enhancement rather than treating it as an inconvenience to manage. The point is not that the flush is enjoyable. For some people at higher doses it genuinely is unpleasant, and those people may have reasonable grounds to consider no flush alternatives. But the narrative that flush-free is always superior misrepresents the pharmacology. Niacin's flush reflects a pharmacological activity that NMN simply does not replicate. Whether that activity matters to you depends on your goals, but you should at least be aware you're trading it away.